Hi, my name is Dr. Michael Dim, and I'm a holistic veterinarian here in West Palm Beach, Florida. I offer in-person consultations for the clients in the South Florida area, and I also offer phone consultations and Zoom consultations nationwide. Now, much of my practice is based in telemedicine, and one of the common questions I ask is, how can I possibly practice good quality medicine when I'm not actually seeing the pet in person? Well, from a preventative medical model, much of what I do with young puppies and kittens is more education, is teaching clients what it is to keep their pets healthy. So they don't need many frequent veterinary exams. Often clients bring their puppies and kittens to veterinarians every few weeks from the time they're a few weeks old up until they're 4 months of age, and frequent visits with frequent vaccines and medications and wormings. And what I try and do in my practice is educate clients on that much of that is not even necessary. And so during a consultation, we go through other aspects of preventative health care that goes into keeping our pets healthy, vaccine alternatives, worming alternatives, herbs. We discuss diet, nutritional supplements. I discuss homeopathy as a system of medicine which can be used both in vaccines as homeopathic vaccines. If clients choose to use the concept of vaccines in protecting their animals, we use homeopathic nosodes. And I talk about homeopathy as a system of medicine to address chronic disease tendencies that are often showing up in younger and younger ages. We review about the role hormones play in our animals, lives, the age that people want to consider spaying or neutering, if at all. I go through the ideal diets to feed our pets, the different options of a fresh species appropriate diet and the variations there are that are out there. So much of what I'm doing in these early visits are to just educate my clients, to teach them, as the word doctor means literally, which is teacher, to teach them the concepts of keeping their pets healthy so they won't need physical veterinary evaluation. As animals age and as they get older, certainly they do develop chronic disease tendencies. But from a homeopathic perspective, what we're doing is we're treating the symptom tendencies of the patient. In other words, we look at the whole symptom totality of the patient and prescribing individualized remedies to address those whole body concepts. So whereas an animal may present with ear or skin allergies or digestive issues, those are just the initial presenting complaint, but there's the whole symptom picture of the patient on a mental, emotional, and physical level that separate that patient apart from other animals with the same conventional diagnosis. And it's those individual symptoms on a whole body level that go into the homeopathic prescription and trying to address that tendency to chronic disease and lessening the susceptibility to not only current flare-ups, but future flare-ups of illness as well on the whole body level. I don't often rely too much on diagnostic testing. Diagnostic testing has evolved, has been way overplayed, in my opinion, in veterinary medicine. We use tests like biopsies and removing tumors and lab work as the gospel of our health of our animals. But again, in homeopathy, we look at the symptoms of the patient. And if an animal's vibrant, eats well, has minimal digestive upset or skin or urinary issues over their lives, then that's health. We use the lab work to kind of back up what we see in front of us. We don't use the lab work as determining this is the health of our patient. Certainly, lab work plays a role and biopsies play a role in diagnosing pathology. But pathology is not what we consider holistic health. Holistic health is a vibrancy of the patient, and it can be determined by an interview, an in-depth interview, which is what I do during my telemedicine consultations, where we go through all of the details of the patient's life, their lifestyle, their individuality, their idiosyncrasies. All of those go into a holistic approach to that animal's health. The role other animals play in the environment, stress, all of it plays a role in a treatment plan for our animals. So, that's why I'm able to actually consult nationwide and internationally. And then I prescribe, as I said, homeopathic remedies that are individually based, along with herbal and nutritional therapies and lifestyle changes. And then, if I need to, I'll instruct the client to go to the local veterinarian and get some lab work or a test. But that's not the guiding factor or the guiding impetus into my holistic practice. And many of us homeopathic practitioners, I'm sure, would agree with me that that's the basis of good health. Symptom reduction, symptom cure, and not so much worrying about what a lab test is telling us or what a diagnostic test is telling us. My name is Dr. Michael Dim, and I'm a holistic veterinarian here in West Palm Beach, Florida. And I offer phone consultations nationwide, as well as seeing patients here in my home and locally with house calls. My website, drdym.com, has more on my practice and how to get a hold of me. Thank you very much.